Hi friends, now I will tell you about Ayurveda, and that is the introduction to Ayurvedic studies. All Ayurvedic studies based on herbal or holistic medicine from ancient India followed two principal schools. First, the school of physicians, and second, the school of surgeons. They dealt with the eight main areas of Ayurvedic studies and specialization. The Kaya Chikitsa deals with the cause of diseases. It says that they occur due to imbalance in the three doshas, the Vata, which means air, the Pitta, which means fire, and Kapha, which means water. These imbalances occur due to the mind and sometimes due to the body. Thus, the treatment deals with the treating of the body, mind, and soul of a person, means complete treatment. The Charaka Samhita is very important writing on the Kaya Chikitsa. Here, various therapies and detoxification methods like Panchakarma are used, but it mainly deals with the diagnosis of a disease in which different methods are used. The symptoms are studied and related treatment is given to diseases like diabetes mellitus, tuberculosis, asthma, and arthritic conditions. It also studies etiology, pathogenesis, and diagnosis of an illness. It says that there are six stages for the development of a disease. They are aggravation, accumulation, overflow, relaxation, build up in a new space or place, and manifestation of the disease. There, the disease can be stopped. There means here in Ayurveda, the disease can be stopped at any stage, even in the initial stage, unlike modern medicine, which can detect any disease in the later stages only. One of the methods of treatment here is detoxification through panchakarma. This reverses the disease through emesis, purgation, and enema, etc. This Kaya Chikitsa here is also used for rejuvenation or renewal of the body. Ayurveda says that our body is made up of seven types of tissues, and they are plasma, blood, whereas in modern medicine we call the blood which includes plasma in it. Here it says plasma, separate blood, separate muscle, fiber, bone, marrow, and reproductive tissues of reproductive fluids. Ayurveda says that surgery was pioneered in ancient India, and it is an important branch of Ayurveda. Thousands of years ago, sophisticated methods of surgery were used in India. These surgeons dealt with tumors, injuries which were internal and external, bone fractures, delivery complications, and also pregnancy complications and blockage in the intestinal loop. Cosmetic surgery was also developed in Ayurveda. These surgical methods are used in modern eye disease treatment. In the ancient texts, the use of surgical instruments is also described. These instruments were made from stone, wood, and other natural materials. And treatment called Shalya Tantra was famous because it could uh, give fast relief compared to slow recovery using herbs. Ayurveda recommended treatments to diseases like hemorrhoids, which needed quick treatment. The long British rule in India and lack of promotion of Ayurveda stopped the progress of Ayurvedic surgery in India at that time when the British rule was going on in India. The Shalakya Tantra ophthalmology deals with the complete treatment of diseases of the head, eye, and the ENT or ear, nose, and throat. A rod was usually used in these treatments. Ayurveda describes five types of pathrigyam. The prognosis of glaucoma was made at the first, and the first surgery of the eye was done. Ayurveda discovered 72 diseases of the eye. Various drugs and medicines were made for conjunctivitis and glaucoma. Removal of cataract was done, and disease of the ENT or ear, nose, and throat were also treated, and cosmetic surgery was done, which included rhinoplasty or the surgery for the change of the shape of the nose, and auroplasty. Also, simple home remedies were made to treat problems like dryness of the eye, migraine, and mouth ulcers, etc. These all are successfully treated today. Friends, this is all I can tell you about Ayurveda, its introduction. For today, I'll tell this much, and I will continue about it in my next video. Till then, take care and lots of love to you all. Bye.